if I told you that the federal government classifies marijuana, the same plant approved for medicinal purposes in multiple states across the country, but that they have it listed as dangerous as heroin and LSD? And if that wasn't shocking enough, they actually have cocaine, meth, and fentanyl, yes, fentanyl that we hear so much about, but they have it listed and classified as less dangerous than marijuana under federal law. This isn't a conspiracy theory. It's straight from the DEA's own classification system. And because of the outdated, irrational system, people like me, patients with multiple sclerosis, other chronic illnesses, are being forced to choose between medical marijuana and other medications used to treat their conditions. If you're watching this and you're thinking, this was wrong, this is unacceptable, you're right. And in this video, I'm going to show you exactly why this needs to change, how it's impacting real patients, but most importantly, what you can do to help fix this incredibly broken American healthcare system. Is that even though the state has legalized medical marijuana, even though I have multiple sclerosis, a qualifying condition, even though I'm following the law, how it was intended, and even though I've never been in any trouble with the law or otherwise, I'm left with an impossible choice. If I use medical marijuana for the symptom relief it's used to target, I am not able to use my other controlled medications that is used for other symptom management issues that I have because of the same disorder. Because this is a Schedule I drug, apparently as dangerous as LSD. And it's forcing our doctors to have this type of conversation with us. Watch it play out. We talked about medical marijuana for several years now. It's finally passed, and I know how excited you've been for this. And I completely understand why. Obviously, you know that.
This makes me nervous.
Now, you meet the qualifications under Kentucky state law because of your multiple sclerosis diagnosis, and you recognize that it helps to supplement your other medications to manage your symptoms. And we get that, I understand that. But I need to be very honest with you about something. That while Kentucky has legalized medical marijuana, the federal government still classifies it as a Schedule I drug, which means it's classified the same as heroin, LSD, even ecstasy. And that means that under federal law, it is still illegal. And I know it doesn't make much sense, I really do, but because of the medications I prescribe for you, like the Gabapentin, the tramadol, and those are federally controlled, I am legally bound by federal regulations when prescribing them. So if I knowingly prescribe them to a patient who tests positive for an illegal substance like THC, but you see all the ones we have to test for, but even one that's legal at a state level, I really could lose my medical license. And I mean, do you see the dilemma that this puts me in as your doctor and even you in? So basically, I have to choose between medications that I've been on for years that's approved federally or a treatment plan that's approved on the state level. However, the treatments actually work best in conjunction with each other. Yes, and I want to emphasize, I fully support your right to explore medical marijuana as treatment. I do not think at all that you should have to choose between relief and your other medications. I really don't have flexibility here. But until federal laws change, this is the reality we're stuck with. And I will continue to support you with treatment in any way that I can within the legal framework that we have. But I just wanted you to be informed before you make any decisions.
That's number 2. I'm gonna be so pissed if there is any issues this time after what I've been through the past 2.5 weeks.
This isn't a choice, it's literally a punishment. It is a sentence without being a criminal, is exactly what it is. And you all, this is the reality for thousands of patients across the country just like me. And it's why this fight isn't just personal, it is necessary. In preparation for my second drug test, I have had to stop using medical marijuana because I don't know what to do. I'm very fortunate to have a doctor like the one that I have for my primary care who supports me in whatever decision that I make. But since I've stopped my medical marijuana in preparation for this second drug test, let me tell you how my body has felt. The muscle spasms have come back stronger. My pain levels have increased. My sleep has become restless, sporadic. And so yet, this really is a choice that I'm faced with. Either my multiple sclerosis symptom management meds that I've been on for a long time and give up the one thing that finally worked to supplement all of them, or to just use the supplement and give up all of my other symptom management meds. And who knows, might be the best thing for me. But no patient should be put in this position. This isn't healthcare. This is a broken system that is forcing people with chronic illnesses to choose between two treatments that are working together. The good news, change is possible right now. Bills like the PREPARE Act are being introduced into Congress to create federal cannabis policy recommendations. But without public support, progress will continue to stall. That's where you come in. Groups like the Marijuana Policy Project are fighting every day for real reform. But they need voices like yours to push lawmakers to act. And a lot of them are. So what can you do? Contact your local representatives and tell them to support medical cannabis patients. Support organizations like the MPP that are working to protect patient rights. Share this video to spread awareness. The more people who understand the impact of these laws, the harder it becomes to ignore. If this video resonates with you, please like, subscribe, hit that notification bell so that you don't miss any videos that I post that have to do with multiple sclerosis or any chronic illness related videos. And thank you for being here. And let's keep pushing for a healthcare system that actually works for the patients, not against them.